What is the treatment for teen depression? If the symptoms indicate that a teen is suffering from clinical depression, the healthcare provider will likely strongly recommend treatment. Treatment may include addressing any medical conditions that cause or worsen depression. For example, an individual who is found to have low levels of thyroid hormone might receive hormone replacement with levothyroxine, Synthroid. Other components of treatment may be supportive therapy, such as changes in lifestyle and behavior, psychotherapy, and complementary therapies. Treatment may include medication for moderate to severe depression. If symptoms are severe enough to warrant treatment with medication, symptoms tend to improve faster and for longer when medication treatment is combined with psychotherapy. Most practitioners will continue treatment of major depression for at least 6 months to a year after symptoms have stabilized. Treatment for teens with depression can have a significantly positive effect on how well the adolescent functions with peers, family, and at school. Without treatment, symptoms tend to last much longer and may never get better. In fact, they may get worse. With treatment, chances of recovery are much improved. Psychotherapy talk therapy is a form of mental health counseling that involves working with a trained therapist to figure out ways to solve problems and cope with depression. It can be a powerful intervention, even producing positive biochemical changes in the brain. In addition to individual psychotherapy, group therapies have been found to be beneficial forms of treatment based on the normal developmental tendencies for adolescents to value their peer relationships. Two major approaches are commonly used to treat teen depression: interpersonal therapy and cognitive behavioral therapy. In general, these therapies take weeks to months to complete. Each has a goal of alleviating the symptoms. More intense psychotherapy may be needed for longer when treating very severe depression or for depression with other psychiatric symptoms. Interpersonal therapy, IPT, this form of psychotherapy helps to alleviate depressive symptoms and helps the sufferer develop more effective skills for coping with social and interpersonal relationships. IPT employs two strategies to achieve these goals. The first is education about the nature of depression. The therapist will emphasize that depression is a common illness and that most people can expect to get better with treatment. The second strategy is defining problems, such as abnormal grief or interpersonal conflicts. After the problems are defined, the therapist is able to help set realistic goals for solving these problems and work with the depressed teen using various treatment techniques to reach these goals. Cognitive behavioral therapy, CBT, this type of psychotherapy has been found to be effective as part of treatment for even severe adolescent depression. This approach helps to alleviate depression and reduce the likelihood it will come back by helping the teen change his or her way of thinking about certain issues. In CBT, the therapist uses 3 techniques to accomplish these goals. Didactic component, this phase helps to set up positive expectations for therapy and promote the youth's cooperation with the treatment process. Cognitive component, this aspect of CBT helps to identify the thoughts and assumptions and ways of thinking that influence the teen's behaviors, particularly those that may predispose the sufferer to being depressed. Behavioral component, this employs behavior modification techniques to teach the teenager more effective strategies for dealing with problems. Medications. The major types of antidepressant medications prescribed for adults are the selective serotonin reuptake inhibitors, SSRIs, the tricyclic antidepressants, TCAs, and the atypical antidepressants. TCAs are sometimes prescribed in adults in severe cases of depression or when SSRI medications don't work but have been determined not to be largely effective in treating teen depression. The monoamine oxidase inhibitors, MAOIs, have fallen out of favor as antidepressants, particularly in adolescents, because of the negative interactions this group of medications can have with numerous foods and medications. SSRI medications affect levels of serotonin in the brain. For many prescribing doctors, these medications are the first choice because of the high level of effectiveness and general safety of this group of medicines. Examples of these medications are listed here. The generic name is first, with the brand name in parentheses. Only fluoxetine, Prozac, and escitalopram, Lexapro, are approved by the U.S. Food and Drug Administration, FDA, for the treatment of teen depression. Any other medications used to treat this illness in teens are therefore considered to be being used off-label, although FDA approved for use in teens with schizophrenia rather than for the treatment of depression. Atypical neuroleptic medications like aripiprazole, Abilify, risperidone, Risperdal, olanzapine, Zyprexa, paliperidone, Invega and quetiapine, Seroquel, are sometimes prescribed in addition to an antidepressant in adolescents with severe depression, who fail to improve after receiving trials of different antidepressants, or in addition to, or instead of, an antidepressant in teens who suffer from bipolar disorder. Non-neuroleptic mood stabilizer medications are also sometimes used with an antidepressant to treat teens with unipolar depression who do not improve after receiving trials of different antidepressants. These medications might also be considered in addition to or instead of an antidepressant in adolescents.